Welcome everyone to today's webinar, How Health Systems are Adapting the Patient Financial Experience During COVID-19. I am Ayla Ellison with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We are looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, I am pleased to turn the floor over to one of today's presenters, Will Riley, to begin today's presentation.
Thank you very much, Ayla. Hello, everybody, and thank you very much for joining our webinar today. My name is Will Riley. I'm the VP of Marketing here at VisitPay. We're delighted that you've chosen to spend a portion of your day with us. Thank you. I'm joined by two of my colleagues, and I'm just going to ask them to briefly introduce themselves. First, Kent Ivanoff, who is the CEO of VisitPay. Kent.
Good afternoon, everyone, and thank you for joining today's webinar.
And I'm also joined by Vince, co-founder of VisitPay and Chief Product Officer, Vince Martino.
Yeah, hello, everybody. My name is Vince, and I look forward to speaking with you all today. Thanks.
So, to set the scene a little bit before we jump into the content and the agenda that we've prepared for you today, our world, probably like your world, has changed radically over the last 8 to 10 weeks. Probably none of us can remember a time when our working lives have been so significantly disrupted in such an unusual way over such an extraordinarily condensed period of time. And certainly the team at VisitPay has been no different from that. We have spent the last 8 weeks working incredibly closely with our clients to help them navigate this strange situation that we found ourselves in. We've been looking at data. We've been trying to understand what's been happening with hospital revenue and payments. We've been looking at patient behavior and trying to understand how patient financial behavior is changing and patient payments are changing. We've been thinking about the recession that we all seem inevitably to be entering. I'm wondering what that means for the economic environment that we are going to be faced with in healthcare over the remainder of the year. We've been working hard from a product perspective. We've made about 20 updates and new features and updated features available in our platform over about 4 releases over the last 8 weeks to try and help our clients deal with the immediate economic fallout that they're experiencing. And we've been doing a lot of benchmarking work with our clients as well to look at how the impact of COVID is affecting different markets in different areas of the country. And what we decided to do was use this webinar time to share some of that experience and those learnings that we've generated over these 8 short weeks. We've been working incredibly closely with our clients, like I mentioned, and a lot of what we're sharing today really can be attributed to our work with them. All of it can be attributed to our work with them. The clients represent a good swathe of the U.S. healthcare system, over 230 hospitals across 13 states, representing about $70 billion in annual net patient revenue. So we've really had quite privileged access to the data and the financial leaders who have been trying to navigate the crisis. And like I said, that's really the genesis of what we wanted to do with you, today. Kent, I think you want to jump in with an intro point here as well.
Yeah, thanks, Will. I'm struck by the sheer response that we've had to this topic and this webinar. It's eclipsed anything we've ever done with Becker's in the past, with hundreds of for-profit and not-for-profit health systems and hospitals alike dialing in and being part of the conversation today. But I'm also struck by, for the first time, we have 6 major EMRs represented. We have insurance companies represented. We have all the major patient platforms represented. Several different consulting organizations represented. A university professor, for example. Rev cycle management technology companies represented. And I think it's an artifact of this entire community searching for answers on what comes next. How do we deal with the issues that COVID is bringing on, both clinically and I think just as importantly for the financial aftermath that's coming for consumers. And we're excited to be leading this conversation, sharing our answer to the case, and really presenting for peer review, I would describe it, as part of this community, how we're contending with this going forward.
Thank you, Ken. That's great. So let me preview the agenda that we're going to cover today. We've broken this into a few sections. Like I said, we have access to a vast amount of data, and we've been able to understand from the data that we can get access to, which, like I said, represents about $70 billion of NPR from across our client base, what's been the immediate financial impact to the healthcare industry of COVID. So we're going to start by just looking at some numbers with you and see what's going on. Secondly, we've prepared some thoughts on how consumer payment behavior changes during a recession. We'll cover this more later on, but when we started VisitPay about 10 years ago, we were emerging from the last great recession that the US economy faced, and we feel that we learned a lot during that time around what the American consumer does, how their behavior changes, and how they pay bills differently during a recession. So we want to talk about that. And then, again, working with our clients, we have come up with a 5-point plan that is designed to allow you to support your patients, but also, very importantly, sustain revenue at a time when you most need it. And so we're going to go through the 5-point plan. We have allowed plenty of time for discussion, and so please put your questions in the tool, and we'll be really happy to get to those as we work through the material today. So I'm going to ask Kent to begin here and talk to us about some of the data and the trends that we've observed over the last few weeks.
So I don't think it's a surprise to anyone that the economy contracted 4.8% in the first quarter of 2020. What's extraordinary about that is that contraction occurred in the last 2 weeks of the quarter. The Congressional Budget Office is forecasting that in the second quarter, on an annualized basis, the economy is forecast to contract 30%. I had the opportunity to hear David Solomon speak. He's the CEO and chairman of Goldman Sachs in a relatively private virtual session a few weeks ago. His comments were pretty striking in that Goldman Sachs' view and their economists' view is that the recession that is now underway is not going to be measured in months in terms of a recovery, but rather measured in years. He went on to say that their view is that half of the losses, the contraction that occurred in the first half of the year might be clawed back in the second half of 2020, but certainly not all of it. The point being that this recession is real. It's not going to be over the summer, unfortunately, and we're all going to have to contend with it for a much longer period of time. So as we think about kind of the lessons that we learned, from the last recession, there's a number of things that will come to mind. But I think the thing that we need to focus on first is what's really happening right now. What have we seen already? And no surprise, what we're seeing across our 200 plus hospital clients with revenues up north of $70 billion is about a 35 to 50% reduction in gross charges in their revenue. Certainly some signs that that's turning, but no surprise that revenue is depressed. Of course, payments as a result of that revenue being depressed start to diminish as claims start to diminish. of course, since patient balances that flow from those claims for balances after insurance, et cetera, also start declining, and no surprise, I'm sure to anyone on this phone call, that the payments that are due on those obligations also started declining. I think the thing that's really interesting about this particular dynamic is the windfall of payments that health systems typically see from a seasonal basis in March and April due to tax returns, et cetera, hasn't materialized the same way it has in the past. And so even though the declines maybe have not been as much as people thought, when you compare it to what we would have said they should have expected, it's a very material change in economics. So when we look at our client data, and this is, again, across all of our clients and indexed to what those clients were generating in terms of revenue back in October of 2019. So it's a little bit like an indexed stock chart. When you look at revenue behaviors over time, as you might expect, there's a dip around the Thanksgiving holiday. There's a dip around year-end holidays. But what's really striking is the dip that occurred due to COVID-19. Across all of our clients, a weighted average decline of about 40% in revenue. Pretty breathtaking drop. I think if you decompose that revenue further, some interesting insights as you split it between inpatient revenue, outpatient revenue, and ED revenue. And what's interesting, I think, is there's about a 35% reduction in inpatient revenue as health systems made way, made room, made capacity for COVID cases coming their way. It absolutely crushed outpatient revenue, certainly in the ambulatory setting, with about a 60% decline across our clients, our integrated clients. And then more than a 40% reduction in the ED revenue. And one of the curiosities about this is we think there's some permanent dislocations in these revenue curves, particularly in the ED space, where consumers are starting to realize that there's different alternatives. Matter of fact, one of our CFOs of one of our health systems said that COVID has forced them down a path, an adoption path of telemedicine, where they have achieved everything they expected to achieve over the next 3 years, they achieved in 1 month because they had to compress their entire learning cycle around how to achieve telemedicine. We think that's a permanent dislocation in the market or change in behavior by consumers. So this slide speaks to how payments have actually come in, and we're looking at a 7-day rolling average, trying to smooth out this chart for across all of our clients. And as you might expect, due to COVID-19, we're seeing a drop-off in payments, and this is payments from all payers, commercial, government, and patients. If you then look at what's coming from consumers, what's interesting is across our clients, in early March, you see that ramp, you see that uptick, and that is expected. That's exactly what we've seen year in and year out. What's interesting, though, across all of our clients is that ramp didn't continue well into April. It should have. Across all of our clients, there was a decline in payments, and it leveled out right about where it had been in the past. But relative to what we would have expected for our clients, there's definitely a gap. The one part of the client revenue stream, or payment stream rather, that has bucked that trend is and I'm not trying to make a sales pitch for VisitPay, but for the type of actions that you need to take with consumers, it does require a different set of tools than what maybe legacy systems are able to offer. So for our clients, depending on when they've implemented, some of are months into their implementation, some are years into their implementation. So our adoption rates, range from 30 to 70%, but the impact is profound across the board. So I'll turn it back to you, Will, to speak to the impact on consumers during the same time period.
Thanks, Kent. So as we've seen payment behavior change, I'm just seeing a few questions coming in about not being able to hear.
Yeah, I heard also that Kent cut out during this slide.
Okay. So Kent, I'm going to ask you to replay some of the commentary on this slide, and I'm going to check that the audio is working. So if you could just summarize your message on this slide that's showing right now again, then we'll take it from there.
Okay. Apologies for that. I'm not sure what happened. Sounds like we had a technology issue. In any event, or telecommunications issue, I guess. In any event, what we're speaking to on this slide is the portion of a health system's payments that come through our platform. Some of our clients are, very new in their visit pay experience. They've only been live a couple of months. Other of our clients have been on the platform for years. And so our impact on a health system's patient payments is a function of whether or not those consumers, those patients, are able to access the functionality in our platform, and whether the client staff are able to access the functionality in the platform, and for what portion of their portfolio. And so this data represents adoption rates ranging from 30% to 70%, again, depending on how long that client has been on our platform. And what it's describing is a doubling of payments through our platform during the same time period, which I believe, and I think what you'll see from the data, is an artifact of having very sophisticated approaches tailored to each consumer and done in a way that drives an economic outcome, but also delights the consumer in the process. And I think that's a nice transition for what Will be speaking to next.
Thanks, Kent. And I think we're back from an audio perspective, so sorry if we lost you for a moment there. So the thing is, the key outcome that we think you want to drive towards is, of course, increasing payments or sustaining payments to the extent that you can, but also maintaining and generating client loyalty and improving patient loyalty. And so we do that by measuring something called Net Promoter Score. I'm sure many of you are really familiar with Net Promoter Score. It's a concept that's used really widely in all sorts of industries, and it's basically a measure of loyalty of someone that's using your products or services. So we've all answered the Net Promoter Score question. It's the how likely are you to recommend XYZ service or product that you've been using. And we use Net Promoter Score because it's correlated with growth. If you are a loyal consumer, then it is reasonable to assume that you're more likely to be a repeat customer, and therefore you're more likely to drive revenue growth. And so when we measure loyalty and when we measure customer satisfaction, we use Net Promoter Score. Now, the number that you're looking at here, it says visit pay, but it's important to remember that certainly the way we work is by we don't share the visit pay brand with patients. So no patient ever knows that they're using visit pay. This score is the score for Intermountain Healthcare, for St. Luke's in Boise, for Carillion Clinic, for Henry Ford, for Texas Health, for our clients, basically. And what the patient is saying is giving a measure of what they feel about the financial experience that health system is offering them. And so we think there's a strong correlation here between payment rate and patient satisfaction, basically, and that the happier your patients are, the more likely they are to keep paying you. And you may ask whether 47 is a decent score. There's various research out there about what a good score in healthcare is. One benchmark shows that the average Net Promoter Score in healthcare is about 16. And of course, that includes the clinical experience, and one might expect the clinical experience to be towards the top end of the scores that the industry could generate. And if you look across other consumer settings, look at like leaders like Apple or Amazon, for example, and then the score looks very comparable. So, clearly we believe that when you're offering a strong consumer-grade experience, then you're going to engender loyalty, which should then result in greater payments. And we'll talk a lot more about how we do that later on, obviously. But okay, so that's the end of our data review session, and we just wanted to talk a little bit more before we get into the strategies themselves that we've been implementing with our clients. We want to talk a little bit more about what happens during a recession. We haven't been in a recessionary environment in the US for 10 years or so, but it seems now that we are wholeheartedly entering one. The data on unemployment is dismal. This is, of course, a universal, a global phenomenon that we're all experiencing right now. I was reading on the BBC news this morning out of the UK that the British recession is going to be the deepest since, I think, 1714, which made me wonder how anyone has been tracking recessions accurately for 300 years, and it also made me wonder what happened in 1714 as well. But I guess the point is that for the first time in 10 years or so, we're looking at a very changed economic environment. And nobody quite knows what's going to happen. But what we've been doing is looking at what did happen in 2008 and 2009 and seeing if there are some lessons that we can learn that might help us prepare for what's ahead. During the recession of 2008, Kent was working at Capital One Financial. We all know Capital One, of course, and he was leading the majority of the North American credit card business there. So we can't quite go back to the 18th century, but we can go back 10 years. And we just wanted to take a few minutes and look at what happened in 2008 and what we might learn to help us prepare for the recession of 2020.
Great, Will. So I will break the lessons into 4 categories, and this is really bridging the lessons from consumer finance with the lessons that we learned in our formative years in this space. Specifically, in the first dimension is payment hierarchy. What was unique about 2008, it was housing driven, as we all know. But one of the interesting dynamics of that is that credit card debt changed in the payment hierarchy for consumers. So historically, it's been housing first, then car debt, then credit card debt, and a number of others, and way down the list is healthcare debt. As consumers were struggling to stay afloat during that housing-driven recession in 2008, credit cards in the payment hierarchy started changing position. And in some segments, it went to the top, not all segments, but some segments, because consumers were trying to stay afloat and credit cards gave them liquidity. I think the lesson for all of us in healthcare is that while healthcare is probably never going to be the number one priority, healthcare debt, I should say, the number one priority for consumers, the fact that you can give them more flexible payment options will have an impact on the likelihood of their ability to be able to meet the demands of the debts that they incur in the healthcare space. The second big learning that we would describe is on payment rates themselves. So one of the things I think is pretty shocking for a lot of people is to learn is that while the recession itself lasted 3 quarters, basically from third, fourth quarter of 2008, first quarter of 2009, before the stock market at least started recovering, delinquency rates across credit cards, autos, mortgages, etc., persisted for a full 8 quarters. So more than twice as long were consumers hurting versus the stock market. So I think the lesson that I would convey to all of us is that plan on a protracted period where payment rates are going to be reduced, fewer balances are going to be paid in full, and consumers are going to need more options to pay over time. The third is as it pertains to insurance coverage. So I think what was interesting about the recession, while unemployment peaked in 2009, the shift from balances after insurance to what we would call pure self-pay, people without insurance, really didn't occur till 2010. I think that's probably from people running out COBRA when they lost their jobs, et cetera. I think there might be a softer landing. There will be a softer landing, I think, due to the Affordable Care Act. But, one of the unintended consequences of the Affordable Care Act, of course, is the rise of high deductible health plans. And so, expect those to persist. And I think a really important part to consider is that in the 2009-2010 time period, most of our clients had, less than 10% of their revenue due from consumers and probably an average of somewhere around 5%. Fast forward to 2019, that number is 20% across all of our health system clients. And we have some clients that are north of 35% of their revenue is due directly from consumers. And these aren't small institutions. These are billion-dollar health systems that just happen to be in a state where the dynamics are such that consumers owe a large balance. The last domain that I would address with our group is just how long this is likely to last. And so, as I said earlier, the stock market started recovering in March of 2009, but unemployment didn't peak until October of 2009. A full 2 quarters later. What's interesting is right now, in 1/4 of the time, we have twice the unemployment impact. It's very acute, and as we said earlier, David Solomon, the Congressional Budget Office, others are saying this is going to be a long recovery measured in years, not months.
Thanks, Kent. Awesome. So what we've done so far, just to recap, is we've looked at what we've seen happening from a quantitative perspective. We've, envisaging a recession ahead, started to think through what we can learn from that, from previous recessions. And now we want to switch to have Vince take us through the plan that we've created with our clients on how to support patients that need help while sustaining revenue flow during what is this uncertain economic time. Just as I hand over to Vince, I want to remind you, please do feel free to pop questions into the tool. We're looking at those. Got some great questions coming in already, and we'll respond to some of those once we review Vince's content.
And Will, I'm gonna set up Vince on this next portrayal. So if you'd advance, please. Yeah, so this is just a portrayal of the marketplace, and I think one of the things that becomes increasingly clear in a recession is that a one-size-fits-all approach cannot work, especially in the dynamic that we face today. And I think it's such a great illustration. If you think about the populations that our clients serve, that this industry serves, there are a number of people. I think we're all impacted by this clearly, but in terms of our financial experience and our clinical experience, the impacts are vastly different. So you can imagine a very small number of people who were acutely impacted by COVID. Ironically, I was one of 2,000 cases in the state of Idaho, which is where I live, where I contracted COVID and knocked me flat for 4 weeks. It was brutal. I was never hospitalized, but I can tell you I wouldn't wish that on anyone. So I'm one of those darker colored avatars here. But then there are a whole bunch of other people who are impacted economically to varying degrees, and it's not a one-size-fits-all approach there either. Some people are acutely impacted economically; they've lost their job. Others have had income diminished. But there's a whole bunch of people, the majority of people, I would say, in the country, who probably haven't been impacted. And so a one-size-fits-all is going to leave somebody out, and it's really going to leave a lot of people out. And so our view is you need to tailor that experience in very different ways. So Vince, I think you're in a great position to speak to that.
Yeah, great. Thanks, Ken. So, what's going to be really important is, just one second.
Yeah.
What's going to be really important is having the ability to identify these groups in the first place, and then be able to segment populations within those groups. When I step back from just this slide deck and think about where I'm from New Jersey, and that might be like one of the most stark examples of why it's important to be able to segment these groups. So in New Jersey, it is save New York City, except for New York City, it is the highest affected state with COVID. It's also going. It is the highest, or one of the highest, most affected states with unemployment because of the intense lockdown that's occurring. And if you back up and look at the entire population, which has always been the case in a place like New Jersey, you have some of the greatest disparity of wealth and income, even within the same zip code. So using models that, like a lot of models in the market, depend on, say, a zip code or some information that, doesn't allow you to segment into the groups, just aren't going to work either, now or going forward. So what's ultra important is to be able to segment these groups in the first place, and then segment within the groups. And really, what we advocate is that you depend on multiple data sources, and minimally that the 3 different types of data sources you should be relying on to do this are financial data sources, demographic data sources, and healthcare data sources. And those provide you the means to auto-segment and differentiate these groups. So now let's, what I'd like to move into is talking about approaches on a group-by-group basis. So let's go more deeply into each one of these groups. So, the first group we'll talk about is people who just haven't been impacted by COVID. Either they haven't been impacted clinically and they haven't been impacted financially. And we hope that remains, the majority of the population. It's roughly 70% of the population right now has not been impacted in any way by COVID. I think that one of the most unique opportunities we have right now with this group, especially as elective procedures resume, is we have a tremendous opportunity to start to push cash collections to the front end, into the pre-service world. And I know a lot of the health systems on the phone have started to do that. And, one thing I would say, though, is, collecting co-pays here isn't going to be enough. Collecting deposits here is not going to be enough. As consumers come into the elective procedure world and are able to schedule more elective procedures or, at all, there's a huge pent-up demand, and also deductibles have not been hit yet this year. So there's these huge deductible balances sitting there that are going to produce very large, and we think that the average balance is actually going to go up as these new procedures are arranged. And we think it's ultra important to be able to schedule payment plans against those estimates at time of scheduling, or and at any point in advance of the procedure. It's not just a challenge; it's an opportunity for everybody in the healthcare space to do that. I will step back for a second and say, we've looked across, like Ken said, over 200 different hospitals in the United States. And one of the biggest challenges we've seen with the ability to arrange payments on larger balances is the accuracy of estimates is frankly not there in a lot of health systems today, and then the availability or the breadth of the estimates is not there today. So, in order to do this effectively, health systems need to be producing accurate estimates, and then estimates essentially across all service lines. And so, without that, this strategy won't be effective. As many of you might have seen, we recently announced a partnership with TransUnion, and just one of the things that drove that partnership was how we looked at the market, we looked across the market, and we felt that the best estimate provider in terms of both accuracy and breadth or availability was TransUnion, and so we've integrated our solution with the TransUnion estimate. Now we can work with any estimate provider in the marketplace, and we do, and any estimate source, and even the legacy EMRs or billing systems. But at the end of the day, we do think that having that accurate, available estimate is super important. And then, the last thing I'll say in this space, and I'll move on to the other topics on the slide, are, once you create that estimate, it's really important to tie that, once you create that payment plan against the estimate, it's really important to tie that plan into the entire billing experience. So it's not an inconsistent or dislocated billing experience for the patient. Their front-end experience is seamlessly integrated into the back-end experience. As far as kind of some of the other things we can, sorry, Will, just a few more there.
I'm sorry.
Yeah, no problem. It's time, we think it's time, and we already have doubled down on trying to drive online adoption. Using the data that you have available to you, data-driven ways to get people to commit to and self-service online is really important. Ken mentioned earlier, one-size-fits-all hasn't worked in the past, and it's especially not going to work in this market, right? You need to be able to offer flexible terms to people, And now more than ever, that's important. We need to sustain revenue, right, in order for these organizations to stay in existence, frankly. And for people who can pay their bill in whole, we want them to pay the bill in whole. For people who can't provide the flexible payment terms they need to pay that bill back in a reasonable amount of time. And then, the messaging to these consumers really needs to be on key, on point. It's the messaging to these consumers is, again, helping you sustain revenue. And, sending out reminders via multiple channels is really important. And then the last thing I'll say is the one way you're not going to get paid back is when you create confusion and friction. So we want to reduce friction and avoid any type of confusion in the billing cycle. And the way that we advocate doing that is creating a consolidated single monthly cycle for the consumer on a date of the consumer's choosing when they're most likely able to pay that bill. A single cycle is a great way to reduce payment confusion. Please advance, Will. So let's talk about the next group, which is those who have been impacted financially by COVID. Either they've lost a job or they have had their revenue, their income impacted in some way. For me, on a personal basis, my wife is a healthcare employee, 60% lower volume. Fortunately, she hasn't been furloughed, but her income has been impacted greatly because of just putting in a lot less time into her job because of the inavailability of patients or elective procedures. So there's going to be people who haven't lost jobs but have had their income impacted. So, in contrast to the prior group, the messaging here is about empathy, right? Understanding the situation, providing information to the consumer about how they can get relief, and then, also with this group, though, driving online adoption. We want to provide those relief options in a self-servicing way to the greatest extent possible. And one of the reasons that what you're going to hear a couple more times is we want to free up your staff, your team, to provide the consumers who need the most help. Invest your team's time with those consumers and then let everybody else self-service online. Tying back to what Kent said earlier from his days at Capital One, what we really want to do is try to engage with these consumers as much as possible, get them to pay within their means, even if it's a small amount, get them engaged in paying. So when the job does come back or their situation hopefully changes, they can pay more, and they're used to that behavior, their engagement, and paying their bill. Just a few more points of this group is, when that consumer arrives, you should have a variety of relief options available. Will mentioned we've released over 20 different features for our health systems to provide options, communication and relief options to our clients. We actually had several other ones that we had built into the platform since day one, given that our platform really was built out of the ashes of the last recession. It was in our DNA or in our thinking about how that platform should be built. But you should be able to present the relief option to the consumer that's right for them. Present it to them in an automated way, and then if they need further help or for whatever reason it's not working for them, they can contact your staff. But you should be able to clear most of this online. And then, Will, I think maybe it'd be great if you shared an example from one of our clients who have engaged with a lot of our relief options.
Yeah, definitely. Happy to do that, Vince. So I work with our clients around patient awareness and patient engagement strategies and tactics to help get folks to self-service. And actually, there's a question that's come in on the webinar here, which we'll answer in more detail later on, but about how to do that. But one of the things that's been interesting over the last couple of weeks is that as we've implemented these new payment relief options to patients, is how at least one of our clients has started to use that much more assertively in the way that they're reaching out to their patient population. They're in a part of the world that's been really hit hard by COVID. And the financial consequences are pretty dire in that part of the world as well. And so what they're doing is taking some of the relief options that they've made available, like Vince was saying, and we're actually promoting that on their website, in emails and in other messages that we're using to reach patients, to tell them that by self-servicing and by coming into the self-service payment environment, the patient is going to be able to access the most preferential and tailored and customized relief options that will fit their specific situation. So really turning the good work that you're doing in terms of providing relief into a rallying call to patients to get them to self-serve and change how they work with you financially. It's been super interesting and eye-opening to do that. And even to the point where we're thinking about doing things like PR around this, right? Because so much of the PR of health systems over the last 8 weeks has rightly been on the clinical side and how the health system is supporting the community through the clinical catastrophe. But what about turning some of the relief options that you're making available and making those the subject of how the health system engages with its community through PR and marketing? Vince, there's a question that's come in that I wouldn't mind answering right now, if we can.
Sure.
Just to make sure that we're all clear. Someone's saying, can we just describe a little bit more about what some of the relief options might be? Could you give us some ideas of that?
Yeah, that sure will. So again, leveraging the vast experience just our company has in the consumer finance space, there are a variety of options we offer consumers, and frankly, a lot of them were offered prior to this situation. Things like payment deferments, it would be a relief option. So enabling a consumer to basically agree to the terms of a payment plan, but not start that plan for X amount of months. Allowing consumers to take a payment, what we would call a payment holiday. So they've started a payment plan, they've been affected by a loss of income, they can self-service and elect to take one to any number of months off. I think it's really important to say that when we provide these options, they're always at the client choice and always at the client's discretion, not just whether they're offered, but then also to what extent they're offered. So if some of our clients have chosen, we offer a best practice and for every relief option, but some of our clients might say, I only want to offer a 1-month deferment from a self-servicing basis, but I would want that consumer to engage with me further if they want more than a month. Other of our clients have said, I'd rather do a 3-month basis of the deferment and then have that consumer contact me after 3 months, because there is a point that you are going to want to engage with that consumer. So we provide those options. They're all automated. They're all available on a self-service basis, but they can be controlled in terms of frequency and availability. Does that work well?
Thank you. Yeah,
no problem.
And please keep asking questions so we can make sure we're being clear and helpful.
Cool. Want to go to the next group, Will?
Yeah.
Okay. Thanks for sharing that. The other thing is I'm from New Jersey and don't have Will's great British accent. So the other, the third group we'll talk about here is the clinically affected group. So this is, on a relative basis, a much smaller part of the population, and let's hope that it stays that way. What this group is, the first thing I think you should think about with this group is providing auto adjustments. So they've gone through something very traumatic. And so one way you can do that is by expanding your write-off policies, and that in a lot of health systems you have a presumptive charity policy today, and to the extent that within your state, changing that policy to also auto adjust or manually adjust for specific clinical situations, I think is a very warranted thing that you can do, and something that we definitely recommend. But whether if you do have that policy, you're going to have some balances written off completely, some partially, but some consumers still contending with large balances. And one of our clients, what we've been doing since 8 weeks ago is we started a weekly call with all of our clients, and it's an optional call. We're checking in, we're providing updates on our solution, we're getting feedback, we're sharing data. And on one of those early calls, I think it was either the first week or the second week, one of the VPs of RevCycle in one of our clients really astutely pointed out that when this clinical situation occurs, unless it's a single person, a single patient who is also their own guarantor, it's likely going to affect an entire household. And I think that's an ultra important point, because what we've done since day one in our company is we've always provided a consolidated bill not just for the guarantor and their patients, but we also provide the opportunity to consolidate across an entire household, or even an extended family, an extended household. And the point I'm making here is that it's really important to do that so you can identify when this clinical situation occurs, and then provide relief potentially for even other bills that household is contending with. And it's not just important to provide relief, but handle the billing situation. You also want to be able to score and segment at the household level. Otherwise, you really want to be able to do this in the first place. So the household piece is a really important one, and we think is a big driver of the ability to do this. Well, did you have a point?
Yeah.
Sure.
Yeah, as we move on, I want to link in a question that we've received as we do it, because Vince is now going to talk about the role that your staff can play in this dynamic. And a question has come in, what about rural communities where people may have a preference for speaking with a person? Actually, one side point on that, the three of us now live in Idaho, which is a pretty rural place, and we actually see really healthy self-service adoption, but you are dead right that not everybody will self-serve, not everybody will sign up for a digital tool. So, Vince, what is the role of the call center in this?
Yeah, well, that's great. And I would say the role of the call center is going to vary by market, and and for us, definitely varies by market and client. You, the health system, should be in control of setting the threshold of when that patient should engage with the call center, or what self-service options they have available to them. But I guess the first point I'd make is online adoption is purely optional. If a consumer doesn't want to adopt online, we're not advocating they have to or they need to. There should always be a means to integrate or contact your staff in a very easy way. So to step back from the question a bit, well, I'll maybe just go through the what we think is the best approach for the staff, and how they should go about engaging with consumers. So we only have 3 groups identified, but definitely an impacted group is going to be your staff, your team. They are going to have to deal with much higher call volumes into the call center, and then also supporting people who've lost their jobs, a very large number of people. So there's definitely a toll we expect and know that this is taking on your teams. And so they're a really important part of this, and they're the 4th group that we're talking about today because of that. We think it's super important. The reason we're advocating online so much is we think it's super important to free up their time so they can deal with the people who need the most help, right? It's not that we're trying to push people online for, just to get them to pay and be efficient. It's that we also want to free up that capacity to help the people who need it the most. You should be able to provide your staff with, tools to communicate very easily. So always a phone call, right? Always a phone call, but also online tools. So synchronous online tools like chat would include text bots and chat bots in there, or asynchronous tools where a consumer can make a support request online that can be handled later, especially when call volumes are high. All the patient-facing tools we talk about to make it easy to pay, like interactive voice response systems, text-to-pay systems, making easy online payments, being able to self-service payment plans, all great for the consumer. But what they also do is they help reduce that burden on your staff, because there are going to be a lot of people who not only that expect and want those tools so they can make very easy, quick payments. And then, we don't believe all relief should be automated, right? There's going to be essentially there should be always an easy way to get in touch with your staff. So we kind of call that gating, right? That if a consumer doesn't see what they want online and they've chosen to come online and don't see what they want, they can easily get in touch with your staff. And there should be a broader array of options available to your staff so they can handle the situation once they engage with that patient. And so it should be based on roles and permissions, of course, but at the end of the day, we do believe that's a really important element of the situation. Okay, and I can just summarize, Will, and then I'll be set. So what we've done is we just shared a lot of different content with you across these 4 different groups. What we've done is we synthesized all that all of that information to what we call our 5-point plan. And again, the point is that we want to first support patients and then help your health system sustain revenue. So the first point in our plan is that we talked about this a lot. I'm going to go through these quickly. Is we want to maximize self-servicing to the greatest extent possible. It should always be optional, but there's going to be a lot of patients who not only can you advance who expect this, right? One of the interesting data points that we've seen is we did each year we do a visit pay report, and in the 2018 visit pay report, we saw about 30% of people say they wanted to receive their medical bills via email. In 1 year, so in the 2019, which just concluded, and we just released the report, in 1 year we saw that number, same group, the same demographics of the groups that we surveyed, jumped from about 30% that wanted to get their statements via email to over 60%. So we saw a 36-point jump in that alone. So patients are expecting to be online, and they want to be online, and they're looking for us all to provide that great experience. And this, in turn, like we said before, frees your CSR capacity. Second, talked about this earlier, is we want to communicate as purposefully as possible. Some people need a lot of empathy and a lot of help. We should provide that in our communications in a targeted fashion. Other people really just need reminders to keep them paying on time in order for you to sustain that revenue. Next, we want to make offers as precise as possible. One size does not fit all, especially today. And we want to digitally deliver those terms as much as we can. And when they can't be digitally delivered, always make those also available through your CSRs. Talked a lot about relief. We want to also, just like we target communications, make precise offers, we want to target the relief appropriately. So when the consumer gets there, we're putting the best relief option that we think they need in front of them. We're not confusing them with the 20 different relief options that are available, but we are providing the right option for them. And then, like I said earlier, we're going to extend that. We're going to extend the ability to provide relief through your team. And then my last point, or our last point, is that we want to continuously learn and improve from this, right? How we deploy on day one is not going to be the best way we could have deployed or you could have deployed, but we want to really create really tight learning loops. And those learning loops should be driven by two things, advanced AI, artificial intelligence, or machine learning. That's an automated way to really drive your really tight learning loops for improvement. Surveys, continuous consumer surveys to understand what they're seeing and saying and how they're perceiving the experience. And then lastly, really good performance reporting that is actually as COVID as specific as possible, given the current situation. So thanks for the time, Will.
Wonderful. Yeah, thank you very much, Vince. Okay, so now we're going to move into the discussion part of our time together. Just as we make that transition, we're aware that we've covered a lot of ground today. We've shared a lot of data. We've shared a lot of the work that we've been doing. We can only go so far. We can only go so deep. We've also got a really diverse audience on the phone today, which is fantastic. If you are from a health system and you want to talk to us in more detail, then we've set up something called our Visit Pay office hours next Wednesday. You can email us at the address there. We're just going to be on the phone for an hour. You're very welcome to drop in, ask us questions, debate some of these points, whatever you want to do. We have a huge number of questions to respond to now. We won't get to all of them. So please just bear that in mind. Next Wednesday, May the 13th at 11 o'clock, drop us an email, and you're very welcome to join that session, and we can dig a lot deeper with you at that time. Now, what we will do, though, of course, is use the next 7 minutes to get through as many of the questions as we can that have been asked, and thank you all for them. I want to start with one that's come in from someone in New York, and let me read it out. It's a long question, but let's tackle this one. The question reads, given that most hospitals require patients to use their charge cards to pay their bills rather than extend the time to pay directly to the hospital, have you considered the compounded impact to the nation by continuing these policies as acceptable? Maybe paraphrase that question, Kent, as you answer it.
Yeah, I think that at the core of the question is, gosh, consumers are under pressure. They're going to be under even more pressure. Our hospitals, compounding that issue by the practices that they employ. And the way I would describe that is this is precisely why you need some type of technology, some type of approach that allows you to deal with the context that you're mission-centric, you're in the business of providing care to consumers, and yet you find yourself, due to high deductible health plans and other dimensions, with more consumer balance than a lot of banks have in the markets that you serve. The difference is you're not set up for that. And so, my first response to that is you need a platform that helps you tailor financial assistance to people who are most in need. Take care of those people first and foremost according to your mission. After you've done that, then the question becomes, how do you meet people where they are that may need more time but aren't really in as much financial need? And how do you balance between receiving payment from those who or how to identify those who can pay and are happy to pay immediately versus those that need more help? And so you need to be able to segment and select and automatically present offers accordingly. But the other thing I think is important is health systems can do something that other entities can't, and that is they typically have strong balance sheets. And as a result of that, rather than having a consumer borrow money from a credit card company, an installment loan company, a recourse lender, a non-recourse lender, why not offer consumers low-cost credit, leverage the power of your balance sheet, and provide people no interest or very low interest options as opposed to high interest credit cards? And to do that in a way where if consumers need to borrow, they borrow from you effectively with longer duration payment plans, and use intelligent offer management to ensure that you don't have everybody on a long-term plan, just those people that need the help. But be also able to take ACH, put people on debit cards, take any form of payment through your platform in an automated fashion.
Thank you, Ken. Perfect. I want to tackle another question. Actually, I'm going to combine two questions that have come in about payment relief options. How many of your clients are utilizing the payment holiday option or the deferred payment plan option? And then what's the average amount of time your clients have allowed for payment holiday? So let's see if Vince can dig into the details there.
Yeah, sure. Yeah, thanks, Will. So actually, we provide the payment holiday. We provide all the options to both your team, the staff, and to the patients, and they can be done differentially. All of our clients to date have actually turned on payment holidays for their staff, so any consumer can access those through the staff. And the large majority of our clients have turned that on through the patient to enable that also to the patient on a self-servicing basis. Not all of them have, but the large majority of them have. In terms of the duration, we see, we think it should vary by market, and it has. In markets that have been hit harder, they're providing typically a 3-month type self-service holiday, and then even greater potentially through the staff. And then I would say markets that haven't been hit as hard, we're seeing more of a 1-month type of deferral situation, or offered to the patient on a self-servicing basis, and then a 3-month deferral to the staff. So that's the typical ranges that we're seeing there.
Thank you, Vince. Thanks. I think we've probably just got time for one more question, unfortunately. But if you've asked a question, we commit to getting you an answer. We will email you a response. So your question has not been wasted. There's a question that's come in. How fast can something like this be up and running in our health system? And I promise all listeners that was not a planted question. One we appreciate. So how fast can we do this?
Yeah, I'll take that one, Will. So our typical deployments are 90 to 120 days for the full-blown, full functionality slate for the health system client. One of the things that Vince has spearheaded with our technology groups is actually creating a very specific, a COVID-specific edition of our platform that can allow a health system to be up and running in as little as 3 to 4 weeks. And that allows us to then add the additional functionality downstream to have the full suite of array, or the full array of functionality available to that health system and their consumers, but to really get focused with those that are very recession-specific functionalities in a very, very short amount of time.
Thank you, Kent. So, like I said, please give us a shout at the email address you can see on your screen, VisitPay at visitpay.com. Come and chat to us next Tuesday if you'd like to learn more. And in the meantime, thank you so much for attending today. We hope you found this information helpful, and we really appreciate your time and your questions. Thank you.
Thank you so much, Will. That is all the time that we have for today, but I wanted to once again thank Vince, Will, and Kent for their excellent presentation. And I also wanted to thank VisitPay for sponsoring today's webinar. Please enjoy the rest of your day, and we look forward to having you join us for future webinars.